Hello, my name is Lee Shrimp, and I'm going to be presenting on the topic Navigating Behavioral Services. The purpose of this presentation is to provide you with information on what behavioral services are, to identify parts of good and bad behavior plans, and to hopefully answer some questions you may have about behavior plans. I'm going to give you a brief history of applied behavior analysis. Behavioral services are based on applied behavior analysis, or what we call ABA for short. ABA is not a new field, and the Journal of Applied Behavior Analysis was launched in 1968. So it's been around for several decades. ABA focuses on using basic principles of human behavior that were discovered through laboratory research to solve important real-world problems, like tantrums, skill deficits, screaming, crying, a variety of different behaviors. ABA looks to the environment for causes of behavior, not to internal mental states or something internal to a person that would be evil or wrong. For example, if a child is engaging in screaming when you ask him to clean his room, screaming may delay him having to do that. If it's a task he really doesn't like, then he's getting something from his environment. He's getting escape from that task. A behavior analyst probably won't say that he's just not a hard worker or he's got a difficult personality. They'll look to the environment for an explanation. When can ABA help? People often think of ABA and autism, but a person doesn't have to have autism to benefit from ABA. There are hundreds of other applications of ABA, including skill building, working on potty training, night waking, transitions, feeding problems, academics, and the list goes on and on. When can ABA help? There's a continuum of intensity of service that ranges from giving general recommendations and coaching to intensive 40-hour-a-week one-on-one intervention with a child. There's also a continuum of the style of service, from naturalistic teaching and child-directed activities to more formal, discrete trial teaching. The take-home point is that ABA isn't a set program and it should be individualized to the person's needs. Who can ABA help? As I mentioned earlier, ABA is a treatment for autism, but ABA can help reduce challenging behavior or increase a skill for all kinds of learners, regardless of the cause, whether it be genetic, developmental, or behavioral. And ABA works not only for people with developmental disabilities, but also for typically developing children and adults. Let's go into more detail about ABA and autism. ABA is one of the few empirically proven treatments for autism. What do we mean by empirically proven? There are 80 years of research on ABA and autism. This research is published in peer-reviewed journals. Researchers have seen clinically significant changes. There have been measurable improvements in language, social skills, problem behavior, and stereotype behavior like rocking or hand clapping. And most importantly, families have seen changes. Who recommends ABA for autism? Several important organizations, including the U.S. Surgeon General and the American Academy of Pediatrics, recommend ABA as a treatment for autism. Let's review some of the strongest evidence for the effectiveness of ABA in autism treatment. There were studies conducted at UCLA in the 1980s that focused on behavior analytic treatment for autism. This involved teaching small, measurable units of behavior systematically. This is where the 40 hours of one-on-one behavioral treatment came from. In this study, children received treatment before the age of 4, and the treatment focused on increasing language, increasing attending, imitating, social behavior, independent play, and self-care skills, and also focused on decreasing tantrums, stereotypy like hand flapping, and aggression. The children in the UCLA study received 2 to 3 years of treatment. When reevaluated, almost half of those receiving intensive ABA had completed first grade and had regular IQ scores. Only one child who was receiving eclectic therapies, so those that weren't ABA, had similar results. When those successful children were retested at age 13, 8 out of 9 were indistinguishable from typical children. The UCLA study provides powerful evidence, but many people have the misconception that ABA must look just like it did in this study, and that's with discrete trials and 40 hours of one-to-one service a week. But the truth is there's no secret formula for success set in stone. The skills you teach a child may be similar, but programs will not be. Also, the repetition of skills are important, and the 40 hours a week can be beneficial, but they don't have to be 40 hours in session of therapy. Skills can be practiced under a variety of conditions, at school, at home, in a clinic, or in the community. This brings up a question. If behavior plans can be so different, how do I know a good behavior plan when I see one? Here are some things you can look for. A good behavior plan should be individualized. The plan should be based on the person in their current environment, should consider the person's strengths and skills, should meet the needs of the family involved, should involve the family in treatment, and focus on goals important to the family and the individual. The plan shouldn't be copy and pasted from a generic form. A good behavior plan should involve coordination of care. Your behavior analyst should be ready to team with other professionals like teachers, OTs, speech therapists, nurses, psychiatrists, etc. Valuable information can be exchanged between professionals. For example, if a behavior analyst is going to work on a child's food refusal, they would want to coordinate with the child's speech therapist first to see if there was a swallowing disorder. A good behavior plan should be function-based. What do we mean by function-based? The plan should be based on reasonable ideas for why this behavior is occurring. Remember, ABA will look to the environment for these causes. An assessment should be conducted to identify the function of behavioral deficits and excesses. Good assessments are comprised of interviews, questionnaires, direct observations, and a review of the person's records. A good behavior plan should involve data. Information should be recorded on behaviors. Treatment decisions should be based on data, not on hunches. Data can be complex or simple. It depends on what you need information about. And data can be taken by almost anyone, parents, therapists, siblings, anyone. Why would you take data? Data can tell you if your program is working, and also when you need to make changes to your program. A good behavior plan should involve learning that extends outside of therapy time. Reducing tantrums won't be useful, for example, if it only happens in one location. Good plans also transfer as much teaching as they can to the natural supports in a person's environment, when it's appropriate. This can involve parents acting as therapists or teachers. When the plan is being implemented by the natural people in an environment, teaching can happen all the time. Teaching moments will occur naturally and won't need to be scheduled. A good behavior plan should involve the least restrictive methods. Restrictive methods should not be used without careful consideration. In some cases, restrictive methods may be needed to keep someone safe. Restraint may be necessary, for example, if a child is hitting his head and causing serious injury to himself. Behavior plans should always try to maximize reinforcement, and the plan should look to teach or strengthen appropriate behaviors as well as reduce inappropriate behaviors. It is important to teach new skills, not just reduce a problem behavior. A good behavior plan should be written by a qualified professional. You should know the credentials of your behavior analyst. Behavior analysts can come from a variety of different backgrounds, but know that a credentialed, board-certified behavior analyst will always have completed coursework, supervision, field experience, and passed a certification exam. It's okay to ask about these things, and we encourage it. When in doubt, ask your behavior analyst. How do you get access to behavioral services? There are multiple funding sources. For example, private insurance, Medicaid waivers, and state funding. But funding eligibility can be complex, and it's a good idea to do some research with your case manager, service coordinator, or insurance representative to see what your family is eligible for. A question you may have is, if ABA is so effective, why don't I hear about it all the time? Behavior analysts are bound by a code of professional ethics, and this affects how they present themselves. Behavior analysts can't promise treatment outcomes. They also can't imply a professional relationship through advertising or dispense clinical advice through advertising. Behavior analysts also can't solicit testimonials from vulnerable populations and can't solicit business from vulnerable populations. For example, if a child with autism is having a tantrum in the middle of a store, a behavior analyst can't go up to that parent because they're in a vulnerable position out in public during this tantrum and offer services. Behavior analysts can describe the potential outcomes and rates of improvement in objective measures. They also can let people know that every individual has the potential to make progress. To review, ABA is one of the few evidence-based strategies for the treatment of autism. ABA also has many other evidence-based applications outside of autism. There is no set-in-stone treatment plan, and plans will vary in intensity and type of intervention for the individual. A good behavior plan should be individualized, involve coordination of care with other professionals, be function-based, involve data collection, extend learning outside of the therapy session, use the least restrictive, effective procedures, include both proactive and reactive strategies, be written by a qualified person, and not promise specific results. Thank you for listening. If you have any questions about this presentation, you can contact us at ibhsadmin@imaginecolorado.org, and there's a list of references on the following slide.